want to move on to diagnosing atopy, and I think go to Prof first. We had the blood test in the previous slide. There's no mention of doing blood testing here to diagnose atopy, and yet maybe quite a lot of vets will take a blood test early on in the process, almost as a diagnostic tool rather than a treatment tool. Do you want to give your thoughts on that?
Yes, it's too easy. There's a test that can be done. It's a blood test. Everyone believes in blood tests. And so so many vets do it. And they assume that the test is diagnostic, even though if you look at the small print, you'll find somewhere that it says this is not a diagnostic test. Millions of people or tens of thousands of people do these tests, and they are probably virtually meaningless. So I think it's a very strong message we need to give, which is you do not diagnose atopic dermatitis or atopy with blood tests.
And of course, the diagnosis of atopy, can be quite complex, but the various criterion came out first from Ton Willemse in the 80s, and then we've had Pascal's and Claude Favreau, who you just mentioned before, with their sort of atopic criterion. What does everybody think of those? Is that, I think when we've done the job for a while, we get a sense of a dog comes through the door. Once we've ruled things out like scabies, these are the sort of things we want to look at. Perhaps, Christina, do you want to make a quick comment on that?
Yeah, I think realistically, again, working mainly in GP practice, you tend to see the cases coming through the door and then automatically assume, oh, it's atopy. I think most of us tend to do whenever you don't have further knowledge on the subject. But realistically, what I tend to find is, yeah, most of the cases would, to a point, fit in with that. But again, going back to what we said before, I think it's very important to make sure that we are not missing out of all the things that we already have spoken before. And obviously use atopy as a diagnosis of, or consider atopy as a diagnosis of exclusion, and not necessarily just rely on, oh, the dog is itching. Oh, well, let's give him some Bravecto and then let's do some blood test. Because I think we are going to, as a blanket, miss so many things that is not necessarily what it will affect in every single case, really.
So right.
Yeah.
Yeah, no, really good point. What about you, David Bentley? What do you think?
Well, most of the cases that come in to see me now are all chronic cases, and they do, a lot of them have the symptoms which are described in these different diagnostic criteria. I basically treat a case by looking for all the ruling out things like scabies, for instance, and treating all the secondary infections, doing a food trial. If it's obviously a perennial problem, if it's seasonal, then it's more likely to be atopy if it's obviously got a seasonal history.
Yes.
So I don't think it's a particularly difficult diagnosis, but yeah, I agree. Doing a blood test or an intradermal skin test is the last thing you do once you've already made a diagnosis if you're going to consider allergen-specific immunotherapy or possibly allergen avoidance.
So it's really, we make the diagnosis of atopy by excluding other things, and then when we do move on to treatment, that's the time, or when we're considering treatment, we would take a blood test. We're going to come to that in a bit. So I think for those of you listening, I think the point is, blood tests are not there to diagnose atopy, they're there to help with treatment.